Good morning, everyone. It's Wendy Johnstone here with the Family Caregivers of British Columbia. If you joined us here before, you'll know that one of my roles at the Family Caregivers of BC is to support caregivers through our one-to-one caregiver coaching sessions and also to provide some educational content through a wide variety of education resources. So Senior Living Magazine, webinars, blogs, and some of our flipbook productions. So it's great to be here today. It's Family Caregiver Month, so thank you to all the caregivers out there. I'm really happy to be here. I'm a bit of an eternal optimist, and so I have to say I'm feeling a bit lighter with the recent announcement around the restart plan. So let's keep hoping for some brighter days ahead. It's been a while since we've checked in on how Facebook Lives work, and so I just thought I would revisit that today before we launch into our topic. And it's just a reminder that Family Caregivers of BC is really pleased to be able to provide support to family caregivers. We've got a 1-800 number, and all of that information is available on our website and can be found on our Facebook Live site as well. If you're an active Facebook user, you can certainly send your questions, your ideas, and feedback through Messenger, and we'll be sure to monitor the inbox on a regular basis to make sure you're directed and supported to the right type of support. We really take confidentiality and privacy very seriously at Family Caregivers of BC. However, this live session is open to anyone using Facebook, so we're not able to take any steps to protect your privacy or the content that you share. So just a reminder about that. And also just a reminder that we do our best to try and represent general themes that caregivers might be feeling or experiencing. However, they may not reflect your own personal experiences or values. And finally, if you want to check our website regularly, sign up for our newsletter and our social media feeds, it's a way to stay really connected to where our organization is providing different events and podcasts and links to other great resources. So I certainly encourage you to sign up for the newsletter to get all of that great information. So without further ado, today we are talking about caregiver as essential partners. And it was interesting this morning. I was out doing an early morning fitness class. It's an outdoor class, and it's down by the marina here in the Comox Valley. It's really quite beautiful. But as I was leaving the house, it was really rainy and windy, and I was summoning the courage to keep going. Just drive to the class, Wendy. And then when I got to my class, the rain had stopped, and there was this beautiful rainbow had emerged. And I instantly thought about Maya Angelou's quote, which is, try to be a rainbow in somebody's cloud. And it made me think about how many caregivers are rainbows in their care recipients' world, especially on those cloudy days. So just a bit of a shout out to all the family caregivers out there who are providing support and care to those that they love and other people that they're caring for. I have to say, and I'm not alone at Family Caregivers of BC, our team dreams of a time when caregiving is less burdensome and caregivers can spend more time with their loved ones and less time navigating the system. And often the first step is creating this awareness of what family caregivers are doing and that really you're doing more than you are before. And we're going to talk a little bit about healthcare providers, the fact that it's not just healthcare providers that don't identify caregivers, at various points where they intersect at the healthcare sector, whether it's medical appointments or assessments or procedures or hospital admission. Sometimes caregivers don't identify themselves. And so sometimes it's healthcare professionals. They either, just lack time or training to engage with family caregivers. And also as family caregivers themselves, they don't always necessarily know how to find their way through the healthcare system or know when to speak up or when, or how to engage. And one of the things that we often hear from family caregivers on the line, through our caregiver support line and even through our coaching sessions and through webinars, is that it's really time consuming it's often exhausting and it can be challenging. So being an essential care partner isn't just about the person you're caring for, that's a big part of that, but it's also making sure that you're recognized and supported. And we're going to talk about a couple of tools that we've recently developed that can help guide you through that process. And I think the other thing that's also really important is that not everyone calls themselves a caregiver. So people who provide care can use different labels. So sometimes people say, well, they're a caregiver, or they're a care partner, or they're a care provider, or they may prefer not to label themselves at all. But what we do know is that caregivers who do self-identify in some way, even if it's within themselves internally, they're better supported. So it can also give an opportunity maybe to reframe it if you don't like the word caregiver, or that it doesn't quite associate with how the role that you think you're playing or necessarily want to play. You can also reframe it to say, I'm looking after so-and-so, and they couldn't manage without my help. You can see it in that lens. So when you do identify yourself, it also helps the person you're caring for. So it ensures that healthcare providers know who to share information with and to ask for from you. So we've got a couple of resources. One of them is, are you a family caregiver? And I see that we've already pointed you in that direction in the chat box, which is great, or in the comments below. And there's another one that is also around what some of the challenges are of being a family caregiver. That's another great supplemental reading to that one. So as I mentioned earlier, what we hear from caregivers around how to be a partner in care is sometimes they're just not sure what their rights are. They're not sure who to speak to about a specific situation. They're not always sure how to approach healthcare providers. They're at times feeling unsure about sequences and like when to speak. And they're not always sure if they've been heard or understood. That's what we're hearing from family caregivers. So I think all of us really understand the value of building relationships, just generally in life, but also as a caregiver, with the people and with the care team and with healthcare providers that we're intersecting with. And if you're a caregiver and you've been navigating the healthcare system or attempting to, or just about to, we do understand that generally the healthcare system is primarily designed for the person receiving care. And that family caregivers often have really important key and essential information about their ability to care, what supports there are, the home environment, the financial situation. So they're often a really critical piece in ensuring the care recipient is getting the right type of care at the right time. And so for family caregivers, you being heard and seen and involved in the actual care team and the processes are going to provide better care for the care recipient, but also better support for you as a caregiver. So we have some really great existing resources in our learning center, and so in the read section of our Caregiver Learning Center, there is a tab called Healthcare Navigation. And that's a really great place to start. There's downloadables, and it'll give you some additional tips and strategies. So for today, really being part of a care team is really about building relationships. It's building about collaborative and cooperative relationships, about how you can be part of that care team, how you can bring your voice forward, being prepared, and I think being realistic about expectations, but also being very persistent and positive and kind. So being a team, part of the care team, if it's not clearly explained to you in the actual time of when you're supporting that care recipient, you'll need to ask about what to expect regarding the person you're caring for, their condition, what the trajectory might be, what to expect in terms of what you're going to need to do as a caregiver. It will help establish where your care recipient is in terms of their care needs in relation to what the healthcare system is able to provide. It will help you with the person receiving the care to develop a plan for particular goals of care. Can help identify questions in advance and prepare so that you can be very specific and concise about what your needs are as a caregiver, but also what the person receiving care needs if they're not able to express that themselves. One of the key foundations of becoming part of the care team is actually identifying the correct person to ask or to approach. And finally, we have found experience and research shows us that is when we keep a written record of account or questions and answers with information about whom you've spoken to and what the results have been or what the next steps are. It often helps with the care planning process, but also making sure that the care recipient's getting the right care and support, and you are too as a caregiver. So having a voice is a really important part of being part of a care team. And it often starts, if able, to have a discussion with the person that you're caring with and establishing your role as their partner in care and advocating and being able to support that individual. Now, in all cases, that's not always easy, and there are some strategies around communication with loved ones. And again, under the read section, if you go into our communication area, there's some ideas on how to have conversations, just good do's and don'ts of communication. I find I could probably read that every day and learn something. The important thing about being a voice or supporting the person you're caring for is that you do want to try and formalize your role. And so it's understanding, where you're at, where you've intersected in the healthcare system, what kind of documentation they need. And that's different sometimes for in hospital or in the community. So it's understanding, what do I need to have in place? And you'll likely have to review, the policies around privacy and consent. And sometimes, every area is a little bit different. So it's frustrating, it's time consuming, but it's also a really important piece. So it also really helps with conversations with healthcare providers to know, what your role and that role's been formalized. So one of the other pieces we often talk about with caregiving is being as prepared as possible. And so having questions in advance and being able to present information in as clear and concise way as possible is often really helpful for you, the care recipient, and the healthcare provider. It's organizing the important questions first is often a really good system to think about. Knowing who is the best person to speak to about certain questions, and again, just keeping a written record of questions, answers, and conversations with people's contact information. It's also really helpful to know around, depending on where you're at and where you are in terms of a healthcare system, if they're, when is the best time to reach people if possible, or finding, understanding, what's the best way? Is it phone? Is it email? If it's in hospital, when is the best time to call? Or if you're visiting someone in hospital, being able to do that as well. We have a section on being realistic, and it is really about collaboration. It's about working with healthcare providers to meet the care recipient's needs and yours as it relates to decreasing the toll on your own well-being. So trying to be clear about what you need help with, and this is where the caregiver support plan is helpful, and we'll touch on that in a second, because it helps you formalize your thoughts around what do you need as a caregiver, what kind of support and information for caring, but also for your own well-being. So trying to be clear with that is often really helpful. Healthcare providers, they often can't arrange everything, or they can't, ensure that everything is in place all the time, but they often can help with information or help direct you. Again, it's time consuming. There's several steps, but it is, how things are currently designed. And so being able to try and work within that system as efficiently as possible is, one of the ways that as a family caregiver, just knowing that things are likely not going to go smoothly, that there's going to be a few hiccups or, challenges along the way. I think also too, one of the things we've heard from healthcare providers is that sometimes, they feel like they're caught between a rock and a hard place. They're following policy directives, and they don't often have a lot of leeway at their level. And so sometimes it's good to know when you need to go to a different person, to be able to have your questions answered. And I think the last piece is, it comes back to the theme of it can be frustrating and time consuming, is that as a caregiver, you're likely going to be responsible for this cross-provider communication and for providing this continuity of information. This might change as our electronic medical records become more seamless and more standard across the board. But that's also a really important role, and just being realistic, knowing that that's, there is going to be a lot of overlap and repetition of information. I think finally we talk about this idea of, being polite and persistent, that, it's really good to know if the person you're speaking to is the right person, if the timing is good. And that goes for yourself as well. Like, is it a good time for you? Being able to present your ideas in a way that is as positive as possible and coming from a place of curiosity, we have found has been very helpful. And just ensuring, like with good communication, that we're also listening to the person that we're speaking with and being patient, and focusing on that conversation, and be able to reflect on what they say. But also to understand that persistence is a really important character skill still to have as a caregiver, because often if we feel like one phone call doesn't produce what we want or give us the answers we need, we often have to keep persisting. And I guess the last section I want to speak to is this idea of the language around the healthcare system, and being able to ask for clarification about terms that you don't understand is really important. So sometimes we don't know, like, well, what do you mean by an assessment? Like, what's included in that assessment, or what's going to happen as a result? Or for some people, it's like, well, what is a care plan? Like, what does that mean in the hospital or in a long-term care facility or at home? And who's responsible for overseeing it and tracking it? Don't be afraid to ask those questions. It's something that means different things in different parts of the healthcare system. I think it's also really good to understand how referral processes work. So, who is making the referral, and what's the expected outcome, and how is that referral going to get processed? And also being able to address, questions to healthcare providers based on their roles and scope. So, for example, the primary contact is your family physician. They're typically supported by a team, and that directs the care and the practice in the community. And so your family physician should always be that first point of inquiry. However, you might find that you're able to address questions to different parts of the team at the clinic based on their role and responsibility. So to finish off our Facebook Live, I wanted to highlight a few new resources we've created. I'm going to start with our Caregiver Rx project. This isn't new. We've been doing this for 6 years, but not many people know about it. And so our Caregiver Rx project really helps healthcare professionals support family caregivers through education, outreach, resources, and partnership. And we recognize that healthcare professionals are critical to the success of identifying, engaging, and referring caregivers. And so this project really helps healthcare providers with strategies to build strong partnerships with family caregivers. And so that's the flip side of working with family caregivers to help them, navigate and advocate and look after themselves as best as they can through the caregiving trajectory and caregiving time. And on the flip side, we are also engaging with healthcare professionals and health authorities, to ensure that family caregivers, the goal is to have them embedded in healthcare systems. So we just wanted to bring some light to that really important work that we're doing. The second one is that we've just recently, and we spoke to this in the last couple of Facebook Lives, and I respect that planning, I love planning, but not everyone loves planning. So I would say it's not as flashy of a topic sometimes, but it's a really important one. And so creating this idea of a caregiver support plan, making it personal, is really about creating a personalized caregiver support plan that really understands your support needs. And it helps you take stock of the here and now with your overall caregiver well-being. It helps you prioritize your needs and deciding, where you think the best kind of support would help you, and making a plan to get there. And it's also about thinking about a contingency plan. So this sort of what happens if the bottom falls out, or if there's a major event and my ability to care is compromised. So that brings us to the end of our Facebook Live. We hope that you have a wonderful rest of the month. It's hard to believe it's June next month already. And just some reminders that you can call our support line. All of the information is on our website and can be found on our Facebook page as well. We really support you on your unique needs, and we help bring awareness into your situation and provide you with resources and listen to you, suggest ideas. And we can also refer you into more of a one-to-one support through our coaching. We've got some great podcasts, so tune into our podcasts while you're out walking, or if you're driving. They're a great way to learn more about other people's stories and to get that wonderful peer support and really good information. Our website has some great resources that we've touched on today. Our watch and listen. And read, and to take online courses for caregiving, really helpful. And also our e-news, I think we spoke to that. So ensure that you've signed up for our newsletter. And I always like to finish the sessions just asking, to ask ourselves, which one or two of these suggestions today will you try to bring forward, in the coming weeks. So thank you very much for joining you, and we'll see you back in June. Enjoy the rest of your week. Bye for now.